Thank you so much, sir, for accepting our invitation and having a conversation with Medgate today. Sir, I would request you to please introduce yourself.
Yeah. Namaskar. I'm Dr. Sandeep Bansal. I'm a cardiologist by profession, and I'm presently the director of Delhi-based Vardhman Mahavir Medical College and Safdarjung Hospital. We are a 2,995 bedded outfit. We are the largest Government of India hospital. So I have seen my role both as head of cardiology for almost a decade and a half, and now as the director of this institute.
Sir, as you said that you have a dual role and you have taken the responsibility of two persons. So you have seen the bedside and the administrative desk. What has been your most transformative experience in this dual role, and how has it shaped your philosophy towards patient care?
Yeah, see, when you are on the bedside of the patient, uh, there are two things. One thing is, what is the ideal treatment for this particular patient, or what is actually the guideline directed treatment for a particular patient? Um, in this, we base our decisions based on what is the best possible treatment on the basis of what is the standard practice worldwide, and you have to adapt this to the Indian scenario many a times. This is something that we call as the science of medicine. There is also another aspect which is called the art of medicine, which basically means that you make your decisions regarding the treatment of a patient based on several other factors: the socio-economic factors, the ethnic background, who is there in the family to take care of the patient. So these are the two important areas that I think I have experienced as a practicing cardiologist. Now, when we turn our roles as director of the institute, you become a part of the government. You have to base your decisions based on the data that we have, the disease burden that we have, and the fact that the treatment has to be both at primary and secondary, and also now in our hospital at tertiary care level. So you have to divide your treatment policies based on where the patient is based, whether he's at a periphery or he's at a tier 2 or tier 3 hospital, or he's at a tertiary care level hospital in our country. So I think this transformation of your perspective towards an individual patient, and on the basis of on a population basis or a policy basis, these are two important aspects of the same coin. The guiding fact is that perhaps the treatments are far more simple. We are able to prune down the treatments to a very large amount if we go strictly basing our decisions on both the population-based approach and individual-based approach. So if we combine the two, the treatments become much simpler.
Thank you so much for your insights, sir. My last question to you is, the stethoscope is often seen as a symbol of care, connection, and competence. But beyond tools, what core values do you believe every young doctor must carry into their practice, especially in public institutions like Safdarjung Hospital?
Yeah, so, long years ago when I was an MBBS student, my professor would often say that the stethoscope is not important. It is what lies between the two earpieces, means your mind, that is more important. We need to understand that in any medical institution, the most important factor which makes an institution great or good is the men who man that institution. Stethoscope identifies the instrumentation. So it is not the instrument that is important. It is, of course, important to help you in making the diagnosis and sometimes in treatment also. But of all the factors, the most important thing is the person. So beyond the stethoscope, it is your intelligence, your application, as I said, your sincerity towards the patient. As long as you keep your patient on the top and make your decision in favor of the patient, I think you will never do anything wrong. There are values that are very much hyped in the media and in general perception. Things like compassion and you should be caring, you should be compassionate. All those values are there. But by and large, I feel if you are sincere to your profession and you keep your patient on the top of every decision making, that is the best thing you can ever do. Actually, uh, I think Doctors' Day, as we all know, is the tribute of the medical fraternity to the late Dr. Bidhan Chandra Rai, one of the most leading doctors that we've had in this country. But I think every day is a doctor's day. And there is no single profession which gives you as much satisfaction as the medical profession. We know that doctors are at receiving end. The societal degeneration is such, a gratitude or a thank from a patient that outdoes every single remuneration that you may get in any other profession. Thank you.
Thank you so much, sir, for your kind words and the whole insights from your side. It was honor of ours, the Medgate today, to have a such full, great, you can say, and conversation with you, sir. Thank you so much, sir.
Thank you.